Hello, my name is Heidi Mercer, and I am a diabetes educator. I am creating this video to discuss with you the subject of insulin. Over the years of all the teaching I've done, this was a word that a lot of people never wanted to hear. Well, I'm hoping that if we keep it simple and clear and help you to understand it better, it won't be such a scary word. So there are a lot of things to talk about in insulin, so I would like to present this in a series, and this is part one. Part one is, why do I need insulin? Well, we have to start out by talking about what diabetes is. And diabetes is a condition in which there's not enough insulin present. It's pretty much as simple as that. It's a lot more complicated than that also, but for our purposes today, that's where we're going to start. So why is there not enough insulin present? Well, this is different for the two different kinds of diabetes. Type 1 diabetes is the result of an autoimmune response. So the immune system attacks the cells in the pancreas that make insulin, and so they no longer can make insulin or not enough insulin. This is a process that can happen very quickly, meaning a person has normal use of insulin, and 2 weeks later they have very little insulin and they can become very sick. It can happen slowly over a couple of years, and this can be confusing for both the patient and for the healthcare providers in trying to decide which type of insulin, which type of diabetes it is. So type 2 diabetes is the result of the body's inability to use insulin, which is called insulin resistance. So when a body has insulin resistance, it's not able to use insulin as it should, and the pancreas tries to make up for that problem by making more and more and more insulin. And over the years, this release of large amounts of insulin starts to wear out those cells that make insulin. So the pancreas, again, becomes not able to make enough insulin to control blood sugars. So why is insulin so important? Well, insulin is required for food processing. We think of it in the world of diabetes as just needed for carbs, but insulin is actually a very busy hormone. I have listed some of the actions of insulin, and you can see that it is involved in carbohydrate processing, in protein processing, and in fat processing. So the more common use we talk about is that it does assist in moving glucose out of the blood. So the glucose is in the blood because it's being transported to all the cells in the body to provide fuel. And in the presence of insulin, in the right amounts at the right time, the glucose moves out of the blood and into the cells where it is used for energy. It is the gas that runs our engine. So it also promotes storage of glucose to be used between meals and overnight. So the glucose is stored in the form called glycogen in the muscles and in the liver. And it also, insulin works to suppress using this glycogen because it's being stored because there's plenty of glucose present. So bullet point number 4, it also assists the movement of amino acids into the cells to boost protein levels. So you know amino acids are the building blocks of protein, and amino acids are needed to rebuild and replenish all the tissues of the body. Insulin also enhances fat storage and slows the use of fat for energy because, again, it's trying to have the body use glucose for energy, but fat can be eventually used for energy in certain circumstances. So the need for insulin, again, is different based on the type that we described previously. So with type 1 diabetes, because, as I mentioned earlier, that the body can be have very low amounts of insulin, and insulin is required to live. So a person might need to learn very quickly how to replace the missing insulin in a way that mimics the release of insulin, in the same way a person without diabetes, how their body would use insulin. So one of the things that's not as well known as the carbohydrate issue is that the liver actually, remember I mentioned glycogen is stored in the liver. And the liver uses this storage to release glucose as needed while you're sleeping because you're not eating. And during the day, if you go extended periods without eating, the glucose will be released by the liver to keep us fed. So insulin is needed, though, to control this level of glucose 24 hours a day. So this is done in using a time-released 24-hour long-acting insulin, or it can also be done using an intermediate-acting insulin. But in some way or other, there needs to be insulin present in the blood 24/7 to control this liver glucose. It can also be done by using an insulin pump. And then after eating, some of the food, the carbohydrate food, usually turns pretty quickly into glucose and enters the bloodstream and needs to be processed. And as you know, this is a need for insulin. Insulin will be necessary to move the sugar out of the blood and into the cells. So this is done by using a fast or a rapid-acting insulin because the food turns to sugar pretty quickly and will build the high levels if there is not enough insulin present to scoot that sugar out of the blood and into the cells. Also, there are a lot of things that affect blood sugar during the day. Stress, illness, activity. And so the blood sugars vary a lot during the day, and there are going to be times when the blood sugar is getting too high. And this is also a time when you would use rapid-acting insulin to move the sugar out of the blood and into the cells to try to maintain some control over those glucose levels. So basically with type 1, it's needed all the time, and it's usually needed early in the disease. Type 2 is a different situation. When a person is diagnosed with type 2 diabetes, it's because the pancreas is making and releasing insulin, but not enough. And that is as a result of what we mentioned earlier, insulin resistance. So the body's cells are basically resisting the normal action of insulin. And so if that action isn't happening correctly, then the sugar spends a lot more time in the blood and can't get into the cells, and the cells really want that sugar to use it as fuel. So in the early days of type 2 diabetes, the pancreas actually might be making large amounts of insulin, but it just can't work like it should. So there still is a problem with too much sugar being left in the blood. Now, there are several different categories of medications that can be used for type 2 diabetes that basically rebalance, that try to control the amount of insulin being released in the blood and to coordinate that with the ability to make the body more sensitive to insulin. So trying to get past that insulin resistance. So these medications are used in combination, of course, with making some dietary choices to match the body's need so that the blood sugars don't climb so high. So these medications sometimes are pills and sometimes they are injections, but they're not insulin. So they are just used to create a situation where the body can better tolerate the blood sugars and the food that's being eaten. So with type 2 diabetes, though, usually by year 10, the need for insulin pops up. And that is because over time, the level of insulin will decline due to that weakening of the beta cell, those specialized cells in the pancreas. So these medications will no longer be strong enough because the bottom line is that the body needs insulin to process food. So eventually, over half the people with type 2 diabetes will be using insulin. So if a person with type 2 diabetes is usually on 2 or 3 of these medications, that's a sign that we need to do more. We need to do more. Those medications no longer are balancing the situation, and the blood sugars are starting to climb. And that is usually a pretty strong indication that the pancreas has become too weak to process food without the assistance of external insulin. So will I need it forever? If I start it now, does that mean I'm addicted to it, or will I ever be able to get off insulin? Well, that's a complicated question. For the diagnosis of type 1 diabetes, the answer is basically yes. Until a cure is found, you need insulin, and there will always be a daily need for insulin that has to be met in some way. So insulin is needed to treat type 1 diabetes. For the diagnosis of type 2 diabetes, it's a bit more complicated. So if the diagnosis is recent and the pancreas still has a lot of power in those beta cells, it is possible to reduce the need for insulin and to give that pancreas a break by reducing insulin resistance. So this can be done by changing eating and activity patterns and losing weight. And if you can drop that insulin resistance, now maybe the pancreas is able to make enough insulin to process the food correctly. When these changes are made, you can't make the changes for 6 months and then go back to the old ways, because when you go back to the old ways, the insulin resistance will return and the high blood sugars will also return. So now if a person's had diabetes for a while, I think in my head it's about 10 years is where I'm starting to think that they're probably not going to be able to do without insulin anymore. If they're already using 2 to 3 medications for blood sugar control, those are both indications that the pancreas might be too weak to do it, to do the job of controlling blood sugars without the help of external insulin. So if you're at the place where the beta cell function has become minimal, then insulin will be needed. Usually, when we start insulin with type 2, we do not need to start as complicated a regimen as we do with type 1, because we're just kind of give a little boost to the pancreas by the once-a-day long-acting insulin. Usually also, it doesn't mean you're able to stop the other medications, because they have been helping in different ways. And if you keep those medications going, you might just need a small amount of insulin. If you completely stop those other medications, the insulin need might be quite high, and then you would need a lot of insulin. So generally with type 2, when we're starting insulin, we leave them on most medications. I will make another video talking in more depth about how we make adjustments in medications when insulin is started. So that is basically why we need insulin and how long it'll need to be taken. The next video that I will be recording is going to be tips on taking insulin for those that have already learned they need it or are on the verge of needing it. Hopefully some of this information will calm fears. I think, like I said, there's a lot of negativity around the thoughts of the word insulin, and it's really not as difficult as many people think. So these tips will include directions for beginners and reminders for those that have been using insulin for years on how to maybe better optimize their insulin use. So until next time.